Millions of Americans suffer from high blood pressure, and now more than ever, so many people are considered to be in that category based off new guidelines just released this week. Our WPTV medical expert, Dr. David Soria from Wellington Regional, is here to give us some insight. I decided to kind of be the guinea pig today. You're going to take my blood pressure. You've got the cuff on. You ready to do this? Yeah, let's go.
All right, let's do this.
And I'm going to be quiet
quick
while you're doing this just so we can get an accurate reading.
Are you ready for this, Melanie?
You told me not to get spooked.
Okay.
That must be a good sign.
All right. Well, I was a little concerned, but you know what? But you know what? It's actually great. It's 112/72, which is actually very good. And so let's talk about the impact of the guidelines, because really, before it was 130 and greater was considered hypertension. Now what they've done, or I'm sorry, 140. Now what they've done is they've lowered it to 130. Now remember, before, that was considered pre-hypertension. So it's not as if all of a sudden, when you get that number over a period of time of measuring your blood pressures, your doctor's going to say, uh-oh, now you have high blood pressure, and now I'm going to recommend blood pressure medications. The same recommendations will apply. In other words, exercise, diet, make sure your lifestyle changes are put into play first before we are going to recommend those medications. But now what that does is it obviously increases awareness. So now what was before, the number has been great as far as number of people with high blood pressure, but now it increases about 15% of the U.S. population. So it goes up to about 105 million people that will have hypertension. So that is almost a third of the U.S. population.
So for lack of a better word, is this almost a gimmick to sound the alarm early?
I think what it is not really. What it is a compilation of many, many studies, and what it shows is that long-term blood pressure of 130 or greater, can be detrimental to your health, especially if combined with other comorbidities. So it's really just being even more proactive, because I think if we extend that awareness to folks that have pre-hypertension, we can prevent the long-term complications. So that's really what it's about. It's not about what's going to happen next week or next month. It's really about what can happen years down the road.
And our viewers right now are seeing on their TV screen the best way to get that blood pressure in check. And you went over this as well. Weight loss, obviously sodium, salt, a biggie. Exercise regularly, and then we hate to see the alcohol. But I mean, what is a reasonable amount? I guess it depends on body weight.
Typically when it comes to alcohol, you're really looking at 2 drinks a day. And believe it or not, 2 drinks per day, and that can be 2 ounces of alcohol, of wine, beer, or liquor, is actually cardioprotective, meaning it's healthy for your heart. Any more than that can be detrimental, so you want to be aware of that. So it's really more exposure, it's more awareness, and it's really just keep it top of mind and make sure you live a healthy lifestyle.
An interesting study for sure. Dr. Soria, thanks so much for coming in this week. We appreciate it.